right, good afternoon, everyone. Thank you for joining us today. My name is Mike Montez, and I'm one of several personal advisors here at MediGap Advisors, and I'll be your host today. My colleague Will Sheridan will also be joining me today to discuss what we need to know about Medicare's annual enrollment period and how to best take advantage of the short window of time that folks are given each year. So today's presentation will be focused on the topic of open enrollment, what it means to you, and we're going to do our very best to make the material as easy to understand as possible. During our next webinar, you'll learn more about Medicare Advantage plans, also known as Part C of Medicare. So stay tuned for an email about that or visit our website to register. It'll take us approximately 20 minutes or so to get through the valuable information you're about to hear. If you stick with us until the end, you'll be completely prepared to take maximum advantage of this important time frame, and more importantly, you'll learn how to save lots of time and eliminate frustrations year after year with our help. The information we'll cover today can potentially end up saving you thousands and even tens of thousands of dollars during your lifetime by helping you make the right choices and decisions about your health care. So to avoid distractions, we're going to go ahead and mute the phone lines. At the end of the presentation, we'll take some questions, and you can also use the chat box to type in your questions as you think of them, and we can address them at the end. And due to Medicare's strict guidelines, this webinar is intended for educational purposes only, so we won't be able to address anyone's plan-specific questions or how one carrier compares to another. However, we will be able to give you some exact instructions on how you can go about getting those specific questions answered at the end if you do have any. And lastly, I wanted just to note that MediGap Advisors is not affiliated or endorsed by CMS, Medicare, or any other federal organization or state agency. So with that said, let's go ahead and get it started. Will, what can you tell us about the open enrollment period?
Thanks, Mike, and thanks for covering the disclaimer part. I don't like doing that part. But why don't we start with what Medicare covers and what benefits. You can choose to have original Medicare, Parts A and B, and then many beneficiaries will purchase a MediGap or Medicare supplement insurance policy to help cover the expenses they are responsible for after Medicare pays. Many of those same beneficiaries then would choose a standalone Medicare prescription drug plan to help cover the cost of medications. The second option is to choose a Medicare Advantage plan. These plans are offered usually with a drug component, but not always. Medicare Advantage plans is simply another way to get your Medicare benefits. It combines Part A, Part B, and Part D, the drug coverage. They're managed by private insurance companies that aren't part of Medicare, but they are approved by Medicare. They must cover medically necessary services. However, they do have different co-pays, co-insurance, deductibles that will be different than original Medicare. Each year you have the opportunity to review the choices, pick the Medicare coverage and or drug plan that is best for you. Our certified advisors can help you determine this and walk you through the process from beginning to end. The open or the annual enrollment period started on October 15th, so a couple weeks ago back now, and it ends on December 7th, which is a Monday this year. It gives those with Medicare a full 7 weeks to compare, make some decisions, and helps them ensure that they'll get their materials, their membership cards, and everything in hand when potential new coverage would start the first of the year on January 1 of 16. Keeping in mind that period of time, whether it's open enrollment or, as I mentioned, there's annual enrollment period, it applies only to Medicare Advantage plans, which is Part C, or prescription drug plans, Part D. It does not apply to your Medicare supplements. You can get those or make changes at any time of the year to a MediGap plan. You may be subject to medical underwriting if you've been on Medicare more than 6 months and depending on where you reside. We'll touch on that more on a future slide. So some of the other dates and time frames to review, many of them have already passed on us. But on September 16th, the Medicare and You handbooks were mailed out to all Medicare members. By September 30th, if you are an existing drug plan or Medicare Advantage plan member, you should have got an annual notice of change and evidence of coverage, outlining any changes in cost sharing, premiums, drug tier structures, etc. October 1st is when plans are allowed to begin marketing. So at this point, you've probably got lots of information from the various carriers on their products. One of the many things that we can help you with at MediGap Advisors is cutting through all the clutter and simplifying your options to make decisions easier for you. On October 8th, star ratings were updated on each of the plans based on past performance. October 15th, as we already mentioned, was the beginning of the annual enrollment period, and it goes until December 7th. So it's a 7-week window to make changes for January of 2016. The evidence of coverage gives you details on plan coverage, cost, and et cetera. The annual notice of change, I would say, covers cost, what is actually covered, as well as the service areas that could change. Some plans might choose to leave Medicare. There could be health or drug plans that are discontinued. I know I've seen a few that are being discontinued. If that's the case, your plan would have sent you a letter before the start of the open enrollment period telling you that it decided to leave your area or leave Medicare. Members whose plans do not renew have a special enrollment period that runs from the 15th of October and actually extends through February of next year. Before you make any changes, there's some things you might need to consider. What your coverage needs are. Do you have or are you eligible for other types of health or drug coverage, maybe through an employer, through a union, through a spouse? If so, go through the materials from that plan, find out how it works with Medicare, how it might be affected by Medicare. Talk to the benefits administrator, insurer, or advisor that might have helped you with that coverage. The key thing to note is if you do drop an employer coverage or a union-type coverage, you probably aren't going to get it back. So make sure that it's the right choice for you. It is oftentimes going to come down to costs, what the premiums are, the co-insurance, the co-pays, the deductibles. Is there an out-of-pocket limit to that coverage? It may vary and may be different if you don't follow certain coverage rules. You'll want to consider what the network is, what doctors and hospitals you have to choose from. Are those doctors accepting new patients? Do you have to stay in network or can you go out of network? Maybe you need referrals. Those are some of the questions you need to ask and that we can help you with. For prescription drugs, do you need join a drug plan? Usually you will want to consider joining a drug plan unless you have credible coverage elsewhere. Will you pay a penalty if you join a drug plan later? What drugs are covered? It's also called the formulary of a plan. Are there other coverage rules that you need to consider based on your prescriptions? And you'll want to consider the quality of the care you got, the doctors themselves, and how the plan is administered. And you want to think about convenience. I mean, are there doctor's office close by at the hours that you want to go to see them? Are there pharmacies that are convenient for you? Is there a mail order? And you want to consider that as a potential money savings for you. You might want to consider, do you travel, whether it be inside the U.S., whether it be during the winter, or whether you travel outside of the U.S. occasionally, what coverage options you might have. Our objective at MediGap Advisors is to make it all easy for you. We can certainly help answer these questions and others that might come up related to Medicare. This is important. We touched on it briefly, but if you have other coverage from an employer, from a union, be sure to check your plan's benefit administrator before making any changes to your coverage. As I mentioned, you probably cannot go back to it when you give it up, and you could lose coverage for you and your dependents if you do. If you already have a Medicare Advantage plan and want to drop it and go back to original Medicare, or maybe just join original Medicare. Maybe you've been on that since you started. You have this option during the enrollment period. In most cases, plans will require a letter from you stating that you wish to discontinue the plan. However, you should know there's no guarantee that an insurance company will sell you a MediGap policy because you may have to meet medical underwriting requirements. The exception to this rule is if you qualify for a guaranteed issue right. For example, if your Medicare Advantage plan leaves Medicare. I talked to actually someone today him and his mom both had the same Medicare Advantage plan, and the plan was leaving. To save you time, our advisors are more than happy to help you determine what might be available to you in your area. If you're currently in a Medicare Advantage plan, you'll also be able to consider switching to another Medicare Advantage plan by joining a new one. If you do so, you'll automatically be disenrolled from the old plan. You can also switch back to original Medicare by joining a standalone drug plan. As we stated previously, if this is your intention, you need to consider if you're going to qualify for a MediGap policy. And, of course, we'll help you clarify whether or not this is the right option for you. Between January 1 and February 14th, there is another window when you can leave a Medicare Advantage plan and switch back to original Medicare. If you make this change, you'll also be able to get a drug plan at that time, a Part D prescription drug plan. Coverage begins the first month after the plan gets the enrollment form. Check to see if you'd be able to get a MediGap policy to help cover the gaps in original Medicare. You might have limited or no options depending on where you live. Again, we can help you determine that. Some insurance carriers don't renew all of their plans. This is usually based on the plan's business decisions. Medicare is not for every carrier. Sometimes it takes an official action or sanction because of a problem with the plan. Hopefully this doesn't happen often, but it can. In this instance, you can switch from your Medicare Advantage plan or drug plan to another. Your chance to switch is determined by Medicare on a case-by-case basis. Sometimes Medicare terminates your plan's contract. If that's the case, you can switch from your Advantage or drug plan to another plan. Your chance to switch lasts until 1 full month after Medicare ends the plan's contract. If your Advantage plan, drug plan, or cost plan is not renewed, you may join another Advantage plan or drug plan between the October 15th to February 28th timeframe. If you join a plan between October 15th and December 31st, it'll begin on January 1st. If you do it between January 1st and February 28th, it will be the first day of the following month. As I said, and plans are required per regulatory requirements to notify you, so you will know if this happens. It's rare, but we wanted to make sure you were aware that it could happen. Those affected can take advantage of the special enrollment periods that we spoke about. Please note that if you do have Medicare, you're covered, and the marketplace will not require you to do anything different with your Medicare coverage, so that Obamacare and the Affordable Care Act do not affect most people, if not all, that are on Medicare. The bottom line is Medicare benefits are changing. The marketplace, or the Affordable Care Act marketplace, does not affect your Medicare coverage in any way. Medicare is not part of the marketplace, and the Medicare open enrollment period lasting until the 7th is the time for you to review your options and make changes to Advantage plan and drug plans. Well, that's most of what we had. I'm going to switch it back to Mike to wrap things up a little bit and see if we might have questions.
Thank you, Will. I appreciate that wonderful explanation on what you can and cannot do during the annual election period and how a person with Medicare can maximize their time. It's very valuable information that folks can continue to use every year to understand their choices during open enrollment. And as a reminder, the enrollment deadline is going to be here before we know it, and we urge you not to wait until the last minute. If you're not yet working with one of our friendly Medicare experts, simply call the main line toll-free listed on the slide right there, 1-866-323-1441, and your call is going to be routed to a licensed advisor that can assist you. And then from that point forward, you'll be able to communicate with your personal advisor via email or phone whenever you have any questions at all about Medicare. You can also schedule an appointment directly on their calendar for a day and time that's convenient for you. And because it's our busiest time of the year, don't be surprised to find that a lot of the appointment slots have already been taken. So again, they call the main line if you don't yet have an advisor that's been assigned to you. If you are working with us already, reach out to your advisor directly by phone, email, or by adding yourself to their calendar. We'll answer any of and all your questions, guide you in the right direction, and help you determine the best course of action. Keep in mind also that we represent all the top carriers and plans throughout the country, so we can help you find the one that best fits you and your situation. And each year, we'll conduct an annual comprehensive policy review to ensure that you're always kept in the highest value, lowest premium options available. Best of all, we can do everything for you from start to finish at no cost to you. And that, folks, concludes our presentation for today. We will now open up the line in case there are any questions out there. In the meantime, I'll go ahead and show a couple of Will's many excellent testimonials from two very satisfied clients. So any questions out there today that we can answer for you while we're here? Going once, going twice. Well, Will, looks like you did a wonderful job, and everyone understands the open enrollment period and what it means for them without any questions. So that's a wonderful job there. Once again, folks, we want to thank you for coming out, taking the time out of your schedule to join us today. We hope you got some value out of the presentation. Also wanted to remind you of our upcoming webinar that focuses on Medicare Advantage plans, and that webinar is going to be taking place, I believe, week after next at the same time on the same line. But just to verify, you'll be receiving some emails in regards to that, and you can also check the website to make sure that the time is accurate. We hope to see you there. Hope you have a great evening, and bye for now.